We'll talk about coughing up blood or hemoptysis. What is the most likely diagnosis if patient comes and says that he coughs up blood? What is the most likely? First and most common is bronchitis. In 40% of cases, usually it's bronchitis, especially if patient said that he noticed red streaks in his sputum, red or pinkish streaks in his sputum. Such patient will not say that he coughs up pure blood without sputum, but he will notice in the sputum some red streaks. That's bronchitis. And how can we detect bronchitis? Patient will say that he recently had respiratory infection, coughing, sputum, and chest discomfort, and these symptoms will resolve within 3 weeks. It's usually bronchitis, especially if person is young, under 40. It's usually bronchitis. Pneumonia also can cause coughing up blood, and probability is 20%. We should notice that for pneumonia, it's not characteristic coughing up blood. It happens only 2% of cases, but because pneumonia affects millions of people during the year, this 2% still high number. That's why we pay attention pneumonia when patient comes with coughing up blood, and we can very easily detect if it's pneumonia because more than 90% of cases we have symptoms like fever, chills, chest pain, and chest pain exacerbated during deep breathing. It's pleuritic nature, and person will remember such pain because it's different and it's severe, and it is exacerbated during coughing or laughing or deep breathing. It's pneumonia. Usually it's bacterial pneumonia, and sputum is yellow or greenish, and this bacterial pneumonia causes usually coughing up blood also. Treatment is antibiotics. In bronchitis, in most cases, we don't need antibiotics, but in pneumonia, we need antibiotics in many cases. Another more important but less common cause is lung cancer. Probability is 15%. Generally, lung cancer is not common disease, but it's still number one killer among cancers. So if it's advanced, more than 50% of cases we have coughing up blood. If lung cancer is in early stages, we have no symptoms at all. But if it's in advanced stages, in most cases we have coughing up blood or hemoptysis. And at this case, patient usually is smoker, or he has history to exposure of asbestos, radon, arsenic, diesel, and maybe other chemicals also. Usually it's after 50, because if it's younger, very low probability that it's lung cancer. But if it's 50 or more and have such risk factors such as smoking history or exposure to such chemicals, then it can be lung cancer, because 90% of lung cancers happens after 50 years, and usually it's diagnosed around 70 years. So age is crucial here, and person can say that he noticed blood streaks in sputum. It's possible, especially if it's early stages of cancer, and maybe if cancer is already advanced, pure blood cough also common and also characteristic, especially if cancer is near to main bronchus. And fourth, and also important, is tuberculosis. Tuberculosis is bacterial infection. It is caused by Mycobacteria tuberculosis, and it causes characteristic symptoms also, and we can detect it easily. First is chronic cough. Person says that he has chronic cough already, maybe for several months or several weeks, and more than 3 weeks. He has hemoptysis, he has night sweats, and he has weight loss. So night sweats, weight loss, hemoptysis, chronic cough is tuberculosis. So it's important that fever can be presented, but usual low fever, low grade fever, not high fever. If it's high fever, if there is sputum greenish, and if person has chest pain during breathing, it's pneumonia. But if no fever or low grade fever and coughing up blood lasts long period of time, and there is weight loss, night sweats, it can be tuberculosis. Tuberculosis and cancers can look like each other because weight loss can be presented in both cases. Night sweats also can be presented in both cases, but tuberculosis can affect any age person, but cancer usually in older adults who has history of smoking or history of exposure to chemicals. That's different. Also, tuberculosis is more common in endemic areas, or if person recently traveled to endemic areas. It's important to ask patient if he traveled recently. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.